So we are recording this video at quite an unusual time. Why do I say unusual? Because we are recording it the day after the match week 2020. And on the one hand, the IMG match rate has been the highest ever. So that's a very good news. But on the other hand, a global pandemic is ravaging. The coronavirus or COVID-19 is damaging the economies, is putting a lot of strain on the healthcare system across all countries. And everyone is reeling from the impact of this new and sudden onslaught of this virus. So we have received a lot of questions from prospective applicants who are applying in September 2020 for the 2021 season on how it may impact their planning. So the intent of this video is to answer some of those questions, and hopefully you can find some useful information as you plan your 2021 match. The coronavirus situation is very fluid and changing every day. So if you are a Caribbean applicant or an IMG, non-Caribbean IMG, whether you are a US citizen in US or you're outside US, you may be impacted by this situation. And hopefully we will be able to answer your questions and help you plan better for the upcoming match. So first, let's see what are the main challenges that this situation throws. So first of them, of course, is your own health and health of your friends, family, and everyone around you. Being healthy is of paramount importance. If you are not in good health, you won't be able to proceed. So, that's first challenge, how to keep healthy in this situation. The second obvious challenge is the travel. The global travel economy has been almost shut down. From or to US is very restricted, and the situation may continue to be so in the coming months. Even domestic travel within countries is an issue. So the B1, B2 visa travel and all those things, they have implications for you. Or if you are in the US, then how do you travel domestically is also an issue. The third more direct challenge for IMGs is the US clinical experience. So many of our students and many of the applicants get US clinical experience during these times, from April on to October and so. So what do you do now if the opportunities for US clinical experience become limited? That's a very pertinent question that many of you have been asking. The fourth question we have received is around research. So it's not clear if the volunteer research positions will open up this year or in the coming few months, or whether the faculty will be in a wait and watch situation, the universities will be in that situation. And then the very important question of the exam. So whether it's a CS exam you need to take, or maybe even CK or any of the other exams. What happens to these exams? As of now, the centers are closed. What happens if they push out the dates and you cannot get the results on time? So there are all these very legitimate questions that applicants have been asking us as relating to the 2020 September application. So let's go over each of these questions, and hopefully we can get you a better roadmap. So first is, of course, about your own health, right? Whether you are in the US or outside, as I said, being healthy is of paramount importance. It's only when you're healthy you can help others and help yourself. If you are an IMG in the US, get a good healthcare insurance. Get a very good insurance. You may need it. Okay, so don't skimp on that. Now, since all of you are physicians, I'm not going to get into details of the precautions you need to take or how to protect yourself. You've read all about it, so you can take care of some of those little things. But the important point here is, if you are in the US, get a good healthcare insurance. The second important thing is about the USCE. So you may know that a lot of hospitals are canceling these electives, these observerships, sub-internships. What do you do now? So yes, some hospitals have canceled it. Others may also cancel it. As you may know, many of the states, New York, California, Illinois, have had stay-at-home orders. So the hospital related rotations may not work in the coming months. But the good news is that there are clinics and these clinics are overflowing. This is the time when a lot of these physicians need help. In fact, many of our Sarthi students have been looking at the clinic-based rotations where now you're seeing an influx of patients, especially relating to primary care. So one of our advice is going to be that if there are rotations in the clinic, please go ahead and explore them. You may want to do it. It's very good hands-on experience that you can get. In fact, if you need help with any of these rotations, you can also look up our website. There are several rotations that we work with many physicians with and which are available as of now. So if there are hospital-based rotations which are not available, explore the clinic-based rotations. The third important thing is volunteering. As you also know, volunteer activities are very important part of your ERAS CV and the entire application. But more important than that, you're all physicians. It is your duty to help out during these times. You are at the forefront of fighting this coronavirus related issues and illness, and every government, every country, every city needs you. So go ahead, and if you're outside the US, you can always form some non-profit. You can join a non-profit which may be helping people out in this scenario. In fact, some of the Sarthi students have started a non-profit out of India, and they are gathering resources and they will be leading some of those initiatives. So if you are interested, we will put the link down, and if you want to help out, you can. But the important point here is that it is your duty to help out during these times. But also, such volunteer activities will give you very good leadership experience. It'll give you experience in how to work in the teams. So take this opportunity to volunteer, to help out where you are needed. Fourth, even hospitals in your home country will need help. And presumably all of you will be certified at least in your home country to practice. So look for these opportunities. Remember, if the USC is difficult to get in this season, your home country experience, your home country LORs will be very, very important. So find out a way to help out, to work in the hospitals in your home country. That can lead to very, very strong LORs during these trying times, and that may come in handy. The point is, there's nothing you will gain by sitting at home not working. So now is the time in your home countries. Go ahead and work at these hospitals and the places that may need your skill as a physician. The fifth is research. As all of you know, COVID-19 or this coronavirus strain is very new. There's not much information, not much is known about it. So if you can get involved in any research around this, that'll be very, very useful. Programs who review your application will always be very curious to know what you have done, when they see coronavirus, COVID-19 related research on your CV. But even otherwise, now would be the time to initiate some research activities. You can do it on your own. You can start literature review, and a lot of research related things can be accomplished now, even if you don't have the appointment at a US hospital to do research. The related activity I want to stress is the statistical tools. Now would be the time to get a good handle on tools like SPSS, SAS, or other statistical modeling tools which you may need down the road, or which could help you as you do some remote research. And yes, you can always write to the faculty, whether in the US or your home countries, and explore options for remote research. You may get lucky. They may have some work for you to do, and that can help you beef up your ERAS CV, get you those skills which otherwise would have been very hard in this situation to get. So keep writing to the faculty in your home country or in the US, and maybe you can get a remote research project. The seventh kind of tip that we have is not to ignore your MSPE, the medical school's performance evaluation or dean's letter, as that used to be called. Historically, IMGs have not really cared about it. The programs have not cared about the IMGs, MSPE, unless, of course, you're a Caribbean grad. But I think in this season, the MSPEs will become important as the programs will get applications from IMGs who may not have enough USCE. So make sure your MSPE is strong. Make sure it follows the format recommended in the AMG schools or some of these Caribbean schools, because MSPEs will become important if the situation continues as it is right now in March or April. The eighth, if you are already in the US on say B1, B2, likely you can get an extension if the flights are closed or there are issues in travel disruption, so you can apply for an extension. In this situation, all governments, all agencies will be more understanding. So if you want to stay back and try in legal ways to extend the visas, maybe that's a possibility. That may even give you more time to explore some clinic-based rotations or some research in the US. So that would be something you want to explore. So the next question we got and relates to the ninth point is about the exams. What about the exams if the centers are closed or they don't open on time, or the CS is delayed and so on and so forth? As of now, the assumption is the match calendar is not changing. That applications will open up for on September 15th. So you should also go in with that assumption. Keep preparing, don't give up. And hopefully the situation will improve in the next month or so, and the exams will not be delayed and the calendars will still be the same 15th September start kind of a thing. But it is an unknown at this point. We don't know how the situation will evolve. Just don't give up. Just don't assume that it will all be pushed out and that ECFMG or other bodies that are involved will definitely give more time. If they give more time, we will deal with it as it comes. But at this point, it is what it is. Just keep preparing. You may have to take the exams close to each other, CK, CS. Just be ready. 10th, and I guess the most important one is don't be despondent. Don't give up on the season, but be realistic. Even in this situation, there will be students, there will be applicants who have managed either to get the US clinical experiences or research already, or they are already in the US and therefore they may have some advantage over you. You have to be realistic. You have to deal with it and you have to do the best given your circumstances. So if you can get home country experience, if you can get volunteering experience, if you can get research, remote research experience, all those things will add up to your CV. So don't be disheartened. This situation is very new to all of us and everyone is dealing with it in different ways. So keep doing what you can, whatever is in your control. So in conclusion, this pandemic will create challenges in the upcoming 2021 season. Some of you may not have enough USCE, some of you may not have exams on time, some of you may not have enough research experience. The issue for you is to be able to understand these challenges, to be able to deal with them as much as you can, and just be smart about it. Goal should be to lead a helping hand to others who need it, work hard, and then hope for the best. And this too shall pass, and we'll all be ready for the 2021 season.